Hello students, welcome back. Today, let us look at development of respiratory system. At the outset, what are the extent of upper respiratory tract and lower respiratory tract? This picture shows sagittal section of face. This is nasal cavity. This is oral cavity with tongue, hard palate and soft palate, which separate the oral cavity and nasal cavity. Behind the nasal and oral cavities, these different colored area, this is pharynx, a funnel shaped fibromuscular tube which leads down into esophagus. The green colored area is nasopharynx behind the nasal cavity. This is oropharynx behind the oral cavity, and this is hypopharynx or laryngopharynx behind the laryngeal cavity. Till larynx, from external nares, whole of this is upper respiratory tract. From larynx below till the alveoli, it is lower respiratory tract. Respiratory tract is communicated to laryngopharynx. These are the objectives for today's session. Let us look at development of lower respiratory tract. This picture shows sagittal section of developing embryo. This is head end, this is tail end. We can see foregut in yellow color, midgut here and hindgut here. In fourth week of intrauterine life, we find respiratory diverticulum. You can observe here in front of foregut in the midline. So this is respiratory diverticulum. You can see here in magnified view, this diverticulum is outpouching of foregut in the midline from the base of the pharynx or floor of the pharynx. This is beginning of respiratory system. So this is also called laryngotracheal diverticulum. In this picture, we can see respiratory diverticulum here. The picture A is side wave. B and C are front wave. Respiratory diverticulum gradually gets separated from foregut. Foregut forms esophagus. Respiratory diverticulum forms the proximal part forms trachea, and distal part forms lung buds, right and left lung. In the proximal most part, it is communicated to the pharynx. It can be seen in this picture where floor of the pharynx can be seen. The laryngeal orifice can be seen in the form of a slit here. This is communication between foregut and respiratory diverticulum. Here, larynx develops. In the proximal most part, larynx develops. In the proximal part, a tube-like respiratory diverticulum forms trachea. In the distal part, the buds form two lungs. This is briefly how respiratory system develops. Now let us look at development of trachea in detail with its anomalies. This is one more picture shows respiratory diverticulum. Here you can see respiratory diverticulum. It is not yet separate from foregut. This is primitive foregut. Here we can see it is getting separated. In the proximal part, it is communicated to foregut. Here, this is trachea. The same pictures, again I'm showing you here. So once respiratory diverticulum is outpouching from the floor of the pharynx in front, gradually the adjacent mesoderm will push in between these tubes. Like this from the right side and from the left side, mesoderm pushes in between the tubes and pinches off and separates trachea from esophagus. Lining epithelium and glands of trachea are developmentally from endoderm. The cartilages of the trachea, connective tissue, and tracheal musculature are developing from splanchnopleural mesoderm. Let us look at some anomalies. When mesoderm separates trachea and esophagus, on either sides, mesoderm meets very near to esophagus, it can cause esophageal atresia. These are few of the other abnormalities which can be encountered. Fistula is one where esophagus and trachea are in communication. This is proximal fistula with atresia of the esophagus. This is distal fistula with atresia. This is proximal and distal fistula with atresia of the esophagus. Here we find fistula, but there is no atresia. This is the most common variety of anomaly. Let us look at development of larynx with anomalies briefly. This is where floor of the pharynx is shown. Laryngeal orifice can be seen in the floor of the pharynx. Pharynx develops from different pharyngeal arches. Near the fourth and sixth pharyngeal arch, in the floor we find laryngeal orifice which communicates to trachea. Differential growth of fourth and sixth arch mesoderms in the pharynx forms this slit in the form of T shape. It gradually forms epiglottis in the front behind the tongue. Epiglottis develops from hypobranchial eminence, and laryngeal cartilages and muscles they develop from sixth and fourth arch in the pharynx. So this is anatomically larynx, that is beginning of lower respiratory tract. This is also called voice box. Mesoderm of fourth and sixth arch give rise to laryngeal cartilages except epiglottis, and most of the laryngeal muscles are developing in fourth and sixth arch. Endoderm gives rise to epithelium of larynx. Some of the anomalies of larynx are laryngocele, laryngeal atresia or stenosis, which can happen because of non-canalization of larynx during development, and laryngoptosis, which is a lower position of larynx which can descend down till the mid of the trachea or in the lower part, that is laryngoptosis. Now let us look at development of bronchi and lungs in detail. Once the respiratory diverticulum is formed, the distal part of the diverticulum shows lung buds, right and left. The right lung bud gradually forms three subdivisions like this, and on the left side it shows two subdivisions in further development. These 3 and 2 subdivisions are representing 3 and 2 lobes of right and left lungs. Let us look at different parts of the lung tissue. These are bronchi having cartilage in its conducting wall. These are bronchioles having musculature devoid of cartilage. So bronchi and bronchiole are conducting part of the lung, and in the terminal part of the bronchiole, which is enlarged here, they form respiratory bronchiole, which have alveoli on their walls and alveolar sacs, alveolar ducts, sacs, and alveoli. These are all respiratory units where exchange of gas happens into the blood. So these are conducting part and these are respiratory part. During development, the lung shows 4 stages. Initially, pseudoglandular stage, next canalicular stage, saccular stage, and alveolar stage. In pseudoglandular stage, it appears like gland, just like an exocrine gland with ducts, acini and ducts. So it is called pseudoglandular stage. In canalicular stage, this type of division is canalized. Yes, initially it is not canalized inside, it gradually gets canalized inside. In saccular stage, in the distalmost parts, it forms saccules. In alveolar stage, it becomes more and more spongy. The density of the tissue becomes lesser, volume of the tissue becomes more as the lung develops gradually towards maturation. This is histological picture of different stages. This is pseudoglandular stage. You can see the density of mesoderm. It is much more. This yellow colored one is the endoderm. In canalicular stage, the alveolar respiratory bronchioles are developing, and in terminal saccular stage, respiratory sacs, ducts are developing, and in alveolar stage, alveoli are being formed, and the vessels in the mesoderm are coming very near to the lining endoderm, so that it gets completely matured. So there are time frames into which these fall in different categories of development. Pseudoglandular stage from 6th to 16th week of development. Canalicular period is from 16th week to 26th week, and saccular period is from 26th week to birth, and alveolar period continues even after birth till 8th year. It is after 27 or 28th week where surfactant is formed inside. This is the time when baby can be survived after birth at 7th month of delivery. These are different time frames which are shown, and this shows surfactant formation where baby can be viable after birth, that is after 27 or 28th week. These are some anomalies of lung development. Lung cysts can be formed if distalmost parts are not in communication with the proximal part. Lung sequestrations, they may get separated from the tree of lung, and lung hypoplasia, there is underdevelopment of particular part of the lung. Agenesis, completely non-formation of one of the lobe or particular part of the lung. And azygous lobe, this shows azygous lobe during the branching pattern of lung bud. It can go beyond azygous vein and it can form a mesoazygous. This is pleural membrane can form mesoazygous around azygous vein. Azygous vein gets incorporated within the lung tissue because of branching pattern of lung bud on either sides of azygous vein. This is azygous lobe. These are few of the anomalies during development of lung tissue. Let us look at development of pleural cavity. This picture shows foregut, midgut and hindgut. This is yolk sac. Yolk sac is in communication with midgut. We can observe respiratory diverticulum here. These are the lung buds on the left and right. The light blue colored zones here, this is pericardial cavity. Here this is peritoneal cavity. And this is pericardio-peritoneal canal on left and right. Same things are shown here as well. This is foregut. This is respiratory diverticulum, right and left lung buds. This is pericardial cavity. This is peritoneal cavity. This is pericardio-peritoneal canal of the left side and right side. Into the pericardio-peritoneal canal, from the midline towards right and left, both lung buds invaginate. They push into these things, these canals. Pericardio-peritoneal canals are the one which are future pleural cavity. Look at this picture. On the right side, lung is dividing into 3 lobes. On the left side into 2. So all are pushing this pericardio-peritoneal canals, and that is how pleura is applied very much on the lung tissue. This becomes visceral pleura. The same thing can be seen from the left side in an embryo. So this is pericardial cavity, this is peritoneal cavity. The yellow colored one is the foregut, and this is the respiratory diverticulum. This is left lung developing, pushing itself into left pericardio-peritoneal cavity. This picture is to show development of pleural cavity and formation of visceral and parietal pleura. This is a pleural cavity, that is pericardio-peritoneal canal into which lung buds are invaginating. The pleura is into 2 different colors shown in this picture, blue and brown color. You can observe here the blue colored one, which is very much applied on the lung tissue, is visceral pleura. The brown colored one is parietal pleura, which are continuous around the hilum. The visceral pleura is developmentally from splanchno-pleuric mesoderm. The parietal pleura is developmentally from somatopleuric mesoderm. This is the summary of today's session.